Well, thank you. Charles Payne. Can I just thank the organisers for the opportunity to speak today. I'll just give you a sense of what I want to speak about. Jumped ahead a few. So you've heard a fair bit already about the geography and the people. I'll say a little bit more about that in the health context. I'll set the strategic context also for the preparation for the pandemic, and then say a little bit about what the response was and the impact has been, and then derive some of the ideas about how we might sustain the gains that we've had. Now, all health services around the world have been impacted in various ways, and we're all trying to achieve the same thing before this happened, and that is to deliver the right care in the right place at the right time. And I'm going to explore how we've tried to ensure that those objectives were maintained and see what benefits there have been in what has happened to us. So you've already heard that the territory is huge and that it has a small population. We have a young population, but we also have an old population. We have premature aging in our population. We have urban and remote settings. We have affluent and disadvantaged communities. It is overall, overridingly, a vibrant population. So the strategic context, we've got a high burden of disease and therefore a high need for healthcare and great distances and limited transport infrastructure. And in the context of this epidemic, a reluctance to leave country and therefore to provide healthcare close to home. So the pandemic itself exposes us in a variety of ways. We have an extremely vulnerable population. We have very high burden of disease of those conditions which make people vulnerable to COVID-19. We have the social conditions for spread. We have a high prevalence and mortality from previous influenza outbreaks. So we know that if we have a pandemic, it's going to spread. And we have a high, therefore, likelihood of a devastating pandemic. If you think of it in conceptual terms, what the system has exposed, what the pandemic has exposed in the system is that we have significant supply constraints in the territory. Those were exposed in a variety of ways. We all know about PPE supply and so on and how that affected everywhere in the world, but we were exposed to those. We had workforce challenges in terms of supply. We also had not a great deal of exposure and increase in demand, but it's even the limited extra cases that we had to deal with did have an impact. So in the context of our health system or what we're trying to achieve, we are endeavouring to be a world leader in the delivery of remote healthcare through collaboration, excellence and innovation. And of course this vision was very greatly tested in the pandemic. In preparing for the pandemic, you won't be able to see the numbers here. We had similar numbers to everywhere else in the world in terms of our expectations of the numbers of cases we'd expect and the deaths. And those might seem wildly exaggerated now, but it could easily have happened. And fortunately didn't for a variety of reasons, and I think we have to take some credit for that, and the public health system deserves a significant credit for the key and important decisions that were made. We did do some significant continuity planning. This next slide is just not for you to read, but it's just to demonstrate that there were a whole series of key recommendations that we came up with as to how we should counter this pandemic. So let's think about what happened and look at what happened. So we've already heard that we had borders were closed, remote travel to the communities was stopped, in the health system, specialist outreach services were ceased except for essential and critical care. That was an early decision we made. When we made that decision, it was seemed to have been a really fairly quite radical decision to do that. But I think it was wise, and that was an early decision that was vindicated later. We had to adjust our outpatient services. There were a whole range of things that we did. But one of the particular things we did was to increase our access to virtual care, telehealth. So let me conclude with some of the opportunities that have arisen from this. Again, trying to achieve the right care in the right place at the right time. I think we've been forced to take a strategic approach, a needs-based approach to planning and clinician engagement. A big opportunity, which again has been pressed on us by these events, is to adapt our models of care, to be more integrated, to use more virtual care, as I've already said. And then in terms of workforce, a focus more on teams, on generalist workforce, on the key decision makers being involved in those decisions and information for those decision makers. And I'll just, that's just shows you what the impact and the increase in telehealth use was. Those are up to June. Unfortunately, it's declined a little since then, but you can see the significant impact on use of more remote forms of providing care. So finally, I'd just like to hand over now, or at least introduce some colleagues who are going to show you a video. So Dr. Priyad Ashana, Dr. Callum Priyad Ashana, and Dr. Sangha Abirantni have recently won an award for the work that they've done, which is a collaborative effort. Collaborating and innovating locally in the territory is their work. Thank you.